You love medicine, but being a doctor is too much for you. So you're thinking about becoming a physician assistant. You've heard that PAs have very similar roles to doctors, but without the long years of training, you won't be tied down to one specialty, and you'll have an amazing work-life balance. Here's how you can decide if becoming a physician assistant is for you. This is Brandon from the PA Strategy. I hope you find this video useful. US News and World Reports ranked the PA career number 3 in the best jobs in the United States for 2022 and number 1 for 2021. So what exactly is a PA, and why is this career so appealing? I'm going to answer these questions and so many more important topics in this video. So what is a PA? Before I answer this, we need to know the history of a PA career to understand its function in healthcare. Physician assistants were developed in the mid-1960s by Dr. Eugene Stead from Duke University to address healthcare access issues in underserved areas of the United States due to a shortage of primary care physicians. Dr. Stead put together the first class of PAs in 1965. It was composed of 4 former U.S. hospital corpsmen. He based the curriculum of the PA program on his first-hand knowledge of the fast-track training of medical doctors during World War II. Since then, the role of a PA has expanded far just beyond primary care. What does a PA do? Well, PAs are advanced practice providers who diagnose illness, do a history and physicals, prescribe medications, develop and manage treatment plans, order and interpret labs, and often serve as a patient's principal healthcare provider. PAs practice in every state and in every medical setting. They have the ability to change specialties at any time in their career or work multiple specialties at once. PAs can work in cardiology, orthopedics, neurology, and even assistant surgery. The specialties they work in are limitless. Once there's a physician working there, a PA can work there too. Let's make it clear though, PAs are not doctors. They work in collaboration with doctors. This isn't necessarily a bad thing. You have a supervising physician to help you by providing assistance, guide you, and assist you if you have any questions. The relationship between a PA and the supervising physician is one of mutual trust and respect. A great relationship can be described as a willing mentor and a willing apprentice. You will always be working under the supervising physician, so autonomy is limited. However, with a strengthened relationship between the PA and supervising physician, your scope of practice and autonomy will increase as well. As mentioned before, the autonomy of a PA is dependent on the supervising physician. Additionally, the autonomy of a PA is dependent on the state you reside in and the hospital or office regulations that you work in. A lot of PAs join this career because of its work-life balance. Their schedule is often predictable, as a PA typically works around 40 hours per week and usually around 3 to 5 days. But all of this is dependent on where they work and what specialty they work in. The typical PA does not have to worry about overnight call and usually does not take work home. Many PAs choose this career due to them being lifelong learners, as being a PA allows them to change specialties during their career whenever they would like. PAs initially have superficial knowledge over nearly all aspects of medicine, but once they specialize, they gain a deep, extensive, and vast knowledge of that particular specialty. When a PA works in another specialty, they will have to continue lifelong learning. It is important to understand that they will continue to learn as long as they continue to practice medicine. The average salary of a PA as of January 2022 in the US is $111,390, and it is on an upward trend. It's important for the PA profession that PAs understand their value and worth. PA programs are approximately 27 months, usually around 2 to 3 years. And this includes classroom instruction and more than 2,000 hours of clinical rotations. Most schools utilize CASPA, an internet-based application platform, to accept applicants to their school. In CASPA, applicants need to submit an essay on why they want to become a PA. Applicants are also required to take a standardized test, whether it's the GREs or the PA CAT. Each school has a minimum GPA requirement needed to apply. You can major in any subject once you satisfy the prereqs needed to apply to a given program. Many prereq courses include biology, chemistry, anatomy and physiology, and microbiology. It is also required for students to have prior healthcare experience with hands-on patient care, known as patient care experience. Examples include working as a paramedic or EMT, medical assistant, and nurse. Some schools have a minimum patient care hours required to apply. Finally, for a strong application, applicants need to have strong healthcare hours, volunteering, and leadership roles. A deciding factor for many people is the expense of attending PA school. So how much does PA school cost? On average, PA school will normally cost you around $75,000 to $80,000 or more. I compared the prices between PA and med school for reference. So what are the negatives of being a PA? As a PA, you won't always get that full autonomy that some people want. You won't be the one always calling the shots. Secondly, being a PA, you won't have the prestige of being the top person in the healthcare field. Third, you'll be making less money than a physician. And finally, oftentimes people misinterpret how awesome a PA is because of their name. People confuse physician assistants with medical assistants due to their name. However, this is not the case. Physician assistants have far more training and a much wider scope of practice as opposed to medical assistants who handle entry-level clinical tasks. Physician assistants are licensed healthcare providers who diagnose and treat patients. In light of this problem, as of May 2021, AAPA declares Physician Associate as the official title of the PA profession. However, since this is still transitioning, PA should continue to use Physician Assistant or PA as their official legal title in a professional capacity. The PA profession is vital, as it was made to fill the gap in our healthcare model. PAs have the ability to connect more with patients and fill the void that comes with the shortage of physicians. PAs are great leaders and great team players. What attracts people to this career is that they have autonomy, but are still able to have guidance from their supervising physician. PAs have an amazing work-life balance. And finally, becoming a PA only takes a couple of years, allowing you to go out and make a positive impact as soon as you can. PAs, nurse practitioners, and MDs are all great professions. They all have their positives and negatives, but it's up to you to decide which one fits you. I will be releasing videos that compares PAs to nurse practitioners in more depth, as well as a video comparing PAs to MDs, so be on the lookout. If you like this video, please subscribe and like for more related content, such as comparing professions, the best study methods, productivity, and more. Thank you so much for watching.